They need a lot of special consideration, and I think as our population ages, we have children of elderly parents the children are 60 years old and their parents are now 85, 90 years old, and they say, oh, I got something to deal with on my hand, because now they have a parent, someone that they're caring for, they're seeing as if this person was a child who isn't brushing properly any longer. Maybe has a medical condition where they're shaking and they don't have the motor skills, or they lack the eyesight, the ability to see properly. They lack the motivation. They're taking all sorts of medicines that cause problems. So there are a number of things that there is no specialty in dentistry for geriatric people, geriatric patients, but there are a number of conditions that occur. You know, geriatric patients come with a whole list of medical problems. They have hypertension, they have diabetes, they have history of cancer, they're taking medicines. Some patients bring in a sheet of paper that looks like a contract. It's a list of 20, 30 medications long, each of which have different interactions, and many of which affect the mouth, and some cause dry mouth, which many patients, elderly patients, deal with. When a patient's mouth is dry, their saliva doesn't lubricate properly, it holds food, it makes things sticky, they get more decay, they're different levels of acidity. So there's all sorts of things that we as dentists and caregivers have to recognize with an elderly patient, and also have to help the caregivers of these elderly patients to take care of. Maybe a grown child has to take care of their elderly parent's mouth by helping them to brush, by bringing them and making sure that they're coming to the dentist 2, 3, 4 times a year as they need to. That they're not in pain if they notice them eating in an uncomfortable way or avoiding certain foods, that they're astute enough to say, you know, are you having pain? Are you having a problem? Do you have to see a dentist on an emergency? These types of things are difficult, and we really didn't have the best training in school to deal with, and that came with further education and understanding, but it's a whole different realm. It's almost dealing with another group of children when you're dealing with patients as they get to different levels of their life. And I've had patients who've been, my oldest patient was 98 years old. I had a patient in their early 90s who I placed implants on because they were so vibrant and still looking to live life, and so there's no preconceptions I have. But there are many patients that they get Parkinson's disease and they're downhill, and it's a struggle to help them and to help their families maintain. And as a primary caregiver, which is a question you asked before that we talked about, that's part of what we do.